Welcome back to Inside Politics. Our guest today, Dr. Jahangir, who's the chair of the Metro Board of Health. We're talking about the fourth wave of the COVID-19 virus that's here in Nashville and across the world. Dr. Jahangir, we're seeing an increase of people getting shots in the wake of what's going on, both here, across the state, and in some places across the country. Here in Nashville, what kind of people are we seeing coming back in? What's convincing? What groups are being convinced that, yes, now is the time to get a vaccine?
You know, I do feel a little optimistic that over the past several weeks, we're starting to see week-over-week increase, 96% increase in vaccinations here in Tennessee this week compared to previous weeks. You know, I think what's convincing people is seeing their loved ones get ill and their friends get ill. The Delta variant's no joke. It is very transmissible. We're starting to see more younger people, more middle-aged people, and people who they thought they were invincible come and get the vaccine now that they've seen people like them get sick.
You've had a number of people who've gotten the first shot, then haven't come back for the second one. Is that continuing to be a problem? And what are you going to do to try to get these people who just got convinced to get their shot to come back and get their second?
Well, here in Davidson County, you know, 54% of Nashvillians have received their first shot. 49% have been fully vaccinated, consistent with the national average, I have to say, and about 10 points higher than the state. But to be as effective as vaccine can be, yes, we need to get that second shot. So here in Nashville, we send out text messages if somebody hasn't come back in the time frame they need to. We'll send out actual mailers if need be. So we try to be very proactive for the people who get their vaccines here at our jurisdiction.
If we don't get things under control sometime later this summer, we start to get into the cooler weather. The history of this virus has been that if it gets cold and people go back inside, the virus goes up again. Are you concerned that's going to happen because we still won't get enough people vaccinated?
Well, see, I think the premise there is that we're still not going to get enough people vaccinated. My hope is that over the next month or so, people will really see how critical it is to get vaccinated. There are leaders who are now stepping up and saying people should get vaccinated. And so I hope that more people are vaccinated. Now, if they don't...
But you need a flood of people to do that. We're 77% below what the peak was of people getting vaccinations back in the spring. That would be a huge amount of people. What's going to make the difference in terms of how you market this to get people to come to it? I know they're scared of seeing their loved ones get ill, but you still got polls that say 30% of the people say, no way and how I'm going to get this vaccine.
I think the best way now to get people vaccinated, it's not me as on TV or somebody else. It's really more of that grassroots effort. So we need to get more leaders involved locally, pastors, community organizers, civic organizations. That's what's going to take people to get people vaccinated. And if we do that and we stop stigmatizing vaccines, I think that's going to be a really important thing.
We see people now saying they've gotten their shots earlier in the spring. Some people got it during the trials. You see people talking about boosters. Israel's giving boosters to their citizens. France is starting to give them. San Francisco is coming up with some way to give extra shots for those who just got the one shot J&J. Are we putting too much emphasis on that right now? Is it too soon to be talking about this? The FDA right now is kind of saying, yeah, we'll get to it, but not now.
Yeah, I think the FDA currently is studying when and how we should get boosters. It's not approved yet. But I think if the immunity wanes down and sometime in the fall they say get a booster, I think it's worth doing it. I want to highlight one thing though. You know, in the state of Tennessee, 2.7 million individuals have been vaccinated. Only 1,600 of those individuals have had what we call breakthrough cases, which is somebody gets a disease after they're infected. Often that's very minor and not a big deal. So I think the key here, though, is vaccines work, and if a booster is needed down the road to continue that effectiveness, it's worth getting. But right now, what is critical for everyone to do is get out there and give their primary vaccine.
In terms of a booster shot, how fair is it on a worldwide basis? The World Health Organization says, hey, wait a minute. Before we start giving a third shot to people, we got lots of people all around the world that haven't gotten their first shot. And the reason that's important, besides just a fairness point of view, is if we don't get the virus under control worldwide, we're never going to get this thing to go back to where we want it to be, because the virus is going to go live there and create problems for us from over there.
Well, I think that is how you cure the pandemic, right? You get as much of the world vaccinated as possible. But I'll tell you, if boosters are needed, we're so fortunate to live in a country that allows us to have the supply that we have, and I highly recommend people to get the boosters. But yes, I think, and you've seen it with programs such as COVAX and other initiatives that the United States has done, we're getting the vaccines out to the rest of the world, but let's also make sure that we get what we need here. And then the people here in the United States need to take advantage of this amazing opportunity we have as Americans.
When the Delta variant declined, you mentioned this earlier, both in India and in Great Britain, it did so somewhat mysteriously, just almost overnight, and nobody is quite sure why. I mean, I think that's great. Everybody wants it to go away, but isn't it a little scary that we don't know why that happened? And what does that say about future mutations of the virus?
Well, I think science sometimes, and that's the whole point of science, right? We'll figure out. I think part of the reason that you see all those, I don't want to say it declined overnight, but it declined quickly. And part of that could be because, again, so many people got infected. Immunity happened at a local level quickly. The herd immunity
and
terminology.
That happened with the Spanish flu too. It kind of disappeared a little bit.
That's right. But I think that's I know a lot of smart scientists are studying this. But again, get vaccinated when we can make it disappear.
Last week, the Centers for Disease Control also changed its guidance on masks. Not only masks in terms of indoor, but in terms of schools. Why do we fight so much about the school? No matter what we do in the schools, it always seems to be in the middle of the controversy. And here it is happening again, going back to schools, and we're having a fight in this state about whether school systems should require masks or should not. So
it's in the 18 months, I guess, I've been in the public eye. I think the schools situation I have three school-age children, and I get the critical importance of having kids in school, and I think that's important. And that's what surprises me most here, Pat. You have kids who can't be vaccinated under 12. You have a intervention in masks that has been shown to minimize spread, that the CDC and also now says that if you're in a class and everyone's wearing masks and one kid tests positive, you don't have to shut the whole class down. I mean, what better way to keep class going than to have kids wear masks in class? Now, in recess and other things, that's not, the CDC hasn't recommended that. The spread is low, but my personal experience with my children and many of my children who I have friends, masks are not disruptive. Kids want to go to school. Kids need to learn. This is in my opinion, the easiest decisions that we can make.
Metro schools are going to go in with a mask mandate, pretty much universal. I don't know about the recesses, but there's been some talk from the state legislature. The House Speaker wants to bring a special session in, and perhaps if that happens, to actually ban school boards from being able to do that. You think they'd be making the wrong move if the legislature does that, right?
Listen, I really don't necessarily have an opinion on what the legislature does or does not. They're elected officials. But here's what I do know.
But it might supersede what Metro's trying to do.
But here's what I do know. I know that last year there were 40 clusters in schools in Nashville. Of that happened either in class or at sporting events, not things. And those 40 clusters probably could have been more if we didn't have masks in place then.
Dr. Alex Jahangir is our guest on Inside Politics. We're back to continue our conversation with him after you watch these messages.